Good day, folks. Alfie Venta here once again of Venta Pain Relief Clinic and VPRC.ca. I'm hoping you're having a phenomenal day. P for phenomenal. Today I'm going to talk about trigger points. What are they? So there might be a number of you guys that have trigger points and not realize you have it, and I'm here to talk about this phenomenon that does occur with people with chronic pain. But before we do that, please like, share, subscribe, pass this on to those that you feel this might be helpful for. We want to thank you in advance. Also, visit our pain management website, vprc.ca. Our latest we have is a video on a stretch, a very, very good stretch for your hip flexors and your quadriceps that you can do at the gym if you are going to the gym or if you have a squat rack. So visit vprc.ca. So now let's define what a trigger point is. So I'm just going to read this off because I haven't memorized it. So a trigger point is a hyper-irritable spot, a palpable nodule in taut bands, so a knot of the skeletal muscles and muscles fascia. Direct compression or muscle contraction can elicit a jump sign, local tenderness, local twitch response, and referred pain, which usually responds to the pain pattern distant from the spot. So just to go back, a jump sign is when the patient on the table, when I press down on a trigger point, they'll flinch. It's just, it's not a very technical name for it, but that's what happens. The person kind of like flinches when I work on the area or I touch the spot. This, by the way, is a definition by two medical doctors that have done a lot of research, Travell and Simmons. And it's from their book, Myofascial Pain and Dysfunction Upper Half of the Body, which is a very, very interesting book. It's got all this research, all these diagrams about trigger points. So now, in other words, like what the definition implies is that you may have pain and dysfunction somewhere locally. For example, you might have pain in the lower back. But it might just be showing up there. It might be symptomatic there, but the problem could be somewhere higher up or lower down. One of the muscles could be a trigger point causing the pain in the lower back, for example. And this has an impact on people with chronic pain and tightness because let's just say you have lower back pain as an example, and you've been getting local treatments on the lower back, when in fact the problem could be higher up or lower down. It could be that there's a trigger point somewhere along the way that's causing the person's problem or maybe even exacerbating the person's issue. So, you just imagine somebody that's coming in that's had pain for quite a long time and it doesn't seem to be getting any better. It could be that, a trigger point is involved or a few trigger points are involved. So, just a question, have you experienced or currently are you experiencing any trigger point phenomena, or at least you think you might have? Comment down below. I want to see what people are talking about in terms of their pain, if they do have trigger points. So now let's discuss 3 common examples. All right, these are common examples that I see a lot at the clinic. The way I work is that I don't necessarily look at the symptomatic area as the problem. Again, it's a symptomatic area. A lot of the times it is the area that's the problem, but many times with chronic pain issues and chronic pain and tightness, it seems to be coming from somewhere else, whether it's a trigger point or even the fascia. So number 1, iliopsoas. This is your primary hip flexor here, the most powerful hip flexor we have in the body. Very common to see injuries in iliopsoas. Especially for those that sit down for prolonged periods, those that do a lot of lower body type of exercises or events such as running, maybe people that do a lot of squats, maybe deadlifts. So the iliopsoas can refer into the lower back. I call it like a Christmas tree pattern, as you can see here in this picture here. It's a Christmas tree pattern in the lower back. And also it can refer into the front of the thigh, kind of close to the groin. So when I work into that area, what will happen is that when I press into those trigger points, the person may tell me, listen, Alf, I'm feeling that in my lower back or I'm feeling it down into my upper thigh. So iliopsoas, very common. The second one is the scalenes. This too is a very common one, especially for those that sit down for prolonged periods with their head forward in front of the computer. You might get scalenes tightness, scalenes trigger point. The scalenes can refer into the chest, into the shoulder blade, down the arm, into the thumb side of your hand. So some might say, well, you know what, Alf, I think I might have carpal tunnel. I don't know why I'm getting this pain down my arm. Maybe the arm is the thing that gets treated when in fact it should be more the neck. A lot of times what I find is that with the scalenes is that it's tight, it's solid. It can be, there's one person that I remember treating, and I commented that it felt like cement going into the scalenes muscle. Now, one way that I could figure out that it's scalenes is that the person might be also complaining about neck pain. So not only neck pain, but also pain down the arm and into the hand. Finally, this one is also a very common one, especially, again, for those that sit down for prolonged periods in front of their desk. This is the lower trapezius trigger point. So you can see here in the diagram, the lower trapezius refers into the neck, into the top of the shoulder, and almost to the base of the skull, actually into the base of the skull. So the person might complain to me and complain about, they're getting this neck pain and this pain to the base of the skull, but they keep pressing on it and they try to get the muscles to relax and it doesn't. Well, the issue isn't there. It's more symptomatic there, and the problem is lower down. And usually when I press into that, people will often say, I do feel that into my neck, into the base of my skull, as a point of a referral, sort of their own commentary on what they're feeling when I'm doing the techniques on that area. So those are the three common examples. This is sort of a superficial level in terms of, giving you some points about trigger points. And what are they? There's a lot of other issues that a person might have. Included with the trigger points, it could be that they might have fascial restrictions with the trigger points that might be exacerbating the person's condition. So if you are looking to book an appointment, just so that I give you guys the heads up, new patients are welcome with a referral from a current Vente Pain Relief Clinic patient or a signed Vente recommendation form. That's downloadable on our website, but this has to be signed by your healthcare provider. There's details on our website. Thank you again for watching. My name, again, is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. Please remember to like, share, subscribe, pass this on to those that you feel this might be helpful for. We thank you in advance. Have yourself a phenomenal day, and we'll see you soon. Take care, please.